Thank you very much, Mr. President. Mr. President, when we were debating the tax relief law, the tax reduction law, the tax cut law, Republicans predicted that it would be very good for the people of our country. Now, Democrats like Nancy Pelosi predicted it would be Armageddon. She said it would be the end of the world. Well, that was just last month, and it's already very clear to me that we have won the argument. People across the country are seeing the benefits. Thanks to this Republican tax relief law, Nancy Pelosi is seeing that hardworking Americans have actually won as a result of this law being passed. Businesses around the country have begun turning those tax cuts into higher wages for many workers. Almost every day, there's another business announcement about bonuses of more than $1,000 for workers, and we're seeing it for hundreds of thousands of workers at businesses all across the country. They're raising wages, also investing millions of dollars back into the workers who make the companies so productive for our country. Mr. President, Democrats are just wrong about tax relief. I'm hearing it at home as I visit with people, and they're stopping me in the drugstore and the grocery store around the state of Wyoming saying, look, anybody that does the math sees it's a good deal for them. Doubled the standard deduction, lowered the rates, child tax credits. All of these things have been very, very helpful, certainly to people in my state of Wyoming. You know, it's interesting listening to Democrats because they think they have good ideas and they're just proven wrong by the facts. And one of the ones I wanted to talk about today, Mr. President, is something that the senator from Vermont has been talking about with regard to health care. And he has essentially wanted to scrap the American health care system and replace it with a government-run system. As he has said, the current system under Obamacare is the most bureaucratic, inefficient, and expensive system in the world. And he often points to a single-payer system, sort of what they have right now in Great Britain. And, of course, who would be paying for that would be the American taxpayers, dealing with the incredible expenses of a program like that. But I just wanted to point out, Mr. President, what is actually happening today in Great Britain in the system that the senator from Vermont, the father of the American single-payer plan, one that a number of other Democrats have signed on to, what's happening there today, where the authorities in Great Britain just told hospitals to cancel 50,000 operations in the month of January, put them off till next month because they're just too busy doing other things. So scheduled operations canceled. Now, these are surgeries for things like cataracts, knee replacements, hip replacements. Facilities are turning away all but the most urgent cases in need of care. They're closing outpatient clinics. And why? Because it's winter. It is flu season. And the British healthcare system is not prepared, based on a single-payer, taxpayer-run system. They're not prepared to deal with the needs of the people of that country. So hospitals across the country of Great Britain have canceled surgeries that have been planned, that people have decided to take off time from work to have done, scheduled into their schedules. Forget it, they have been delayed. One doctor in England actually said that they are seeing, in his words, third world conditions. Third world conditions describing the British healthcare system today, and this was an Army doctor who did 3 tours at a field hospital in Afghanistan. Somebody knows what third world conditions are truly like. An article in the British newspaper The Guardian out yesterday said, quote, hospitals are reporting growing chaos, with a spike in winter flu leaving frail patients facing 12-hour waits, and some units are running out of corridor space. Now, that's what the situation is like in British hospitals right now today. It turns out it happened before in Great Britain. Last winter, they had a similar problem with too many sick people and not enough options for care. Back then, the British Red Cross called the situation a humanitarian crisis. So today's New York Times, this morning's edition, page 9, talking about the British healthcare system and the problems with it. The chief executive of the National Health Service in England, Simon Stevens, in a speech to Parliament recently, it said, the National Health Service waiting list will grow to 5 million people coming down the line. Grow to 5 million people. How will the American people like to be one of 5 million people waiting to get an appointment, waiting for an operation, in the waiting line? That's what Senator Sanders and the Democrats who proposed this government-run system are talking about for our country. Scenes unfolding across hospitals in Britain, and I'll just describe one as outlined and written about today in the New York Times. Tuesday night, it says, the emergency ward at Kensington Hospital in southwestern London looked more like an airport lounge than a hospital. More like an airport lounge than a hospital, with patients sprawled out in the waiting room. There's no real system of order. It's a jungle in here, said Nancy Harper, who had accompanied her 87-year-old grandmother who was lying down and complaining of excruciating pain in her lower back. She said, it's been more than 5 hours, Ms. Harper said. We get to the front of the line, of the queue, and then someone more ill comes in, and we get pushed back. It's outrageous. That's the healthcare system that our Democrat colleagues are promoting for the United States, with government-run, government-deciding, government-rationing care. Now, you know, the system in Great Britain, Madam President, is strained under normal conditions, even when it's not flu season. There's no margin for error. When something as routine as winter hits, the healthcare system goes completely off the rails. Is that the kind of chaos that Democrats in Washington want for the United States of America? Third world conditions in hospitals, frail and elderly patients waiting 12 hours in a hallway just to get care, people getting a call telling them that their surgery that they have been planning for, maybe have family members coming to take care of other things around the home or to take care of grandma, that, well, just put it off, I'll have to wait till next month. 50,000 people receiving that call in Britain this month. When the government controls health care, Madam President, it always ends up rationing care. When the bills start adding up, so do the delays. That's what happens everywhere in the world when they try a single-payer scheme. They get long lines of people waiting for care, care being denied. Senator Sanders has put out the same plan a couple of years ago. And it's interesting because one of the most liberal columnists at the New York Times, the newspaper that ran this story today about the British healthcare system, said that this single-payer plan would lead to rationing. Well, it does. The article went on and said that in order to keep the costs down, Washington would have to, quote, say no to patients, telling them that they can't always have the treatment they want. That's the side of the story that the Democrats will not talk about, Madam President. The author of that editorial in the columnist in the New York Times had said that Senator Sanders isn't coming clean on that. The Democrats aren't coming clean on that. That's what happens in a single-payer system. Democrats who are pushing for a Washington takeover of Americans' health care are still not coming clean about the rationing of care that it would cause. Republicans think patients and doctors should be the ones making those decisions, not government bureaucrats. Democrats who want to pass this new litmus test, and it is a litmus test for the liberal left, say Washington should make decisions for us. Madam President, I disagree. They say that you're going to get what the government gives you. And to me and to the American people, that's not what the American people want. As a doctor who's taken care of patients for 25 years in Wyoming, patients want the care they need from a doctor they choose at lower costs. That's the goal, not single-payer, government-run health care. Parents need to be able to be involved with the doctor, hospital, their child, in terms of what's best for that child, not the government coming in and making the decisions. Seniors ought to be able to decide along with their doctor whether it's time for a new hip or a new knee, not the government saying we're only going to pay for this many this year and that's it. And if we're not done this year, get in line and wait for next year. Oh, and when next year comes in January, 50,000 operations, pushing back another month. It's unfortunate, Madam President, when we see what's happening with the British healthcare system for the patients there, the doctors, the nurses, the shortages, all of the issues that they have there. The issue is, do we want that for our country? Madam President, we do not. I started this by talking about Nancy Pelosi calling the tax relief reduction bill Armageddon and the worst thing in the world. Madam President, she was wrong on that, and Senator Sanders is wrong about his claims that a one-size-fits-all government-pay national health care plan that all the American people would be under, with government control, not individual choice, not patient control, working with their doctors and their communities, I believe would be wrong for America, and I believe that the Democrats who are supporting that, proposing that, have a different view of America than certainly the people of Wyoming. So, Madam President, I think what's happening in England is a mistake, would be a mistake for the United States. It's not a mistake. It's not something that the American people want or will, I believe, ever tolerate. Thank you, Madam President. I yield the floor.